So we also, in conjunction with minimally invasive dentistry or biomimetic dentistry, we're also trying to prevent cavities, for example. Now, as you know, a lot of kids get cavities very early. In fact, some of these cavities are immediately, just as the tooths come in the mouth, they've already got a cavity. And so it probably didn't have a whole lot to do with brushing and flossing so much, but it's just that they have some deep grooves or some small defects in that tooth that's caused decay. So we can now treat those teeth early and be very conservative in that way. And so what we've got is called air abrasion. It's basically little small sand particles that we use with air or different types of gas like helium that actually cuts the tooth very efficiently without creating a lot of heat. And this doesn't create microfractures as a traditional burr would cause. When you take a carbide or a diamond burr to a tooth, you get small cracks in that tooth, and those cracks will eventually lead to bigger cracks, and it could cause you to lose your tooth. So if we can not touch a tooth with a burr, that's a big advantage to saving tooth structure. So then what we can do is we can take our air abrasion technique, clean out those grooves without anesthetic, without numbing, without noise of the burr, and we can clean out those grooves around those angles, and then we can put a small material in there that is basically bactericidal and won't allow cavity to get back in there. So that's a technique we're excited about doing. It's not easy to do. It takes time to do this, but it's worth it for these kids. And then that way they will never need a filling, a crown, an implant, any of that we've had to do in the past.